A record number of daily coronavirus cases in North Carolina. This as we're learning more about the vaccine plan for Hampton Roads. First, health officials in the Tar Heel State report more than 7,500 new cases. That's the first time we've gone above the 7,000 mark. Virginia reported 3,400 more cases today. Tighter restrictions in North Carolina start today. It's our turn on Monday in Virginia. Tonight, we're learning more about the vaccine distribution process once they arrive in Hampton Roads. And 10 on your side, Stephanie Harris is live in the newsroom with that part of the story. Steph?
Anita, we are still waiting for the FDA's final approval, which could come tonight or tomorrow. Meantime, 2 Hampton Roads hospital systems are working around the clock to get ready for the vaccine and its unique challenges. Here in Hampton Roads, Centera and Riverside will be receiving the first doses of Pfizer's COVID-19 vaccine.
We do expect that we should start seeing vaccine shipments in the state of Virginia as early as Monday.
Both hospital systems have purchased the ultra-cold freezers the vaccine requires, and both are training pharmacists and nurses.
We're not used to using ultra-cold freezers. I mean, that's a brand new technology for us.
They have to wear gloves and meticulously time out their workflow. Here's why. The vaccine comes in trays of $9.75. If workers remove a full tray from the freezer, they've got just 5 minutes to move it, say from a freezer to a cooler packed with dry ice. If the tray has $9.74, they've only got 3 minutes.
And once you open a pack and you put it back in the freezer, you cannot reopen that package for 2 hours.
And once they start immunizing, they must keep records for the CDC, tracking the vials and the people who must get a second dose 21 days after the first. The first to roll up their sleeves will be healthcare workers on the front lines, doctors, nurses, respiratory therapists, those who deliver food and clean the patients' rooms.
We are planning to hopefully start vaccination as early as next Wednesday.
They'll do a dry run on Monday. The plan is to take it slow, making adjustments when needed and keeping in mind those first in line.
If we're going to be taking team members offline to get the vaccine, or if we're going to be asking them to get the vaccine after the end of a very long shift, we want to make sure we're being respectful of their time. We want to make sure that, we do this right.
And Riverside is planning to stagger the vaccine distribution among workers to account for possible side effects that may impact a person's ability to work. I'm told that some may experience flu-like symptoms for a day or so. They're also requesting that the unit managers of the hospital consider scheduling about a third of their staff each time. That way the entire unit could be vaccinated with both doses by the end of January. Stephanie Harris, 10 on your side.
We have new information.